where he leads the hospital COVID-19 response task force. He's also chair of the African Sepsis Alliance and a member of the WHO COVID-19 Therapeutics Working Group. He will be talking to us about vaccine side effects, a topic which, not surprisingly, is causing a great deal of anxiety at present. So, Emmanuel, if you'd like to go ahead.
Thank you, Dr. CamDocUK, and thank you for that kind introduction. I'm just going to share my slides, and I hope you can see them. It's a pleasure to be talking again at this CamDocUK webinar, second webinar on COVID-19 vaccines. I'm going to be focusing on the side effects of COVID-19 vaccines. Just as a recap, it's no surprise that to anybody here that COVID-19 has resulted in a staggering number of infections and deaths worldwide. It's by far the most important pandemic we've had so far in our lifetime. We have 125 million people being infected with COVID-19, with over 2.8 million deaths globally so far. We also, in the UK, have seen 4.3 million cases with 125,000 deaths in the UK, and in Africa, over 4 million people infected with COVID-19 and 110,000 deaths. And this is by far an underestimate in Africa, and we are going through a second surge in most countries of Africa, including Cameroon. Now, these are numbers and they sound like statistics, but we are all, I'm sure, conscious that there are individuals on this webinar and many other people who have been personally affected with losing family and friends. And so it's not just statistics we're talking, these are people whose lives have been significantly affected by the pandemic. Now that we've had COVID vaccines for approved and rolled out for over 4 months, just over 3 months, we now know that COVID vaccines are by far the single most effective control strategy for COVID-19. Public health measures do work and they are effective, more difficult to implement, but vaccines are by far the most effective. And the minimum in terms of percentage of reduction of severe and moderate disease and therefore hospitalization and death is 80%. And some of the vaccines is up to 90% reduction in the risk of being admitted to hospital with COVID-19 or dying. So significant reduction in risk. We've also now had over 25 million doses of the vaccines administered in the UK, and worldwide over 450 million, getting to 500 million doses administered globally. So we do know what the potential effects are of the vaccine in terms of effectiveness, but also we have large amount of data with respect to side effects, and we know that these vaccines are safe. So what are the main side effects of COVID-19 vaccines? The side effects are rare. Most people will have minor side effects, and these are considered minor side effects, but in infectious disease terms, we refer to them as actually expected effects, because it's an indication that the vaccines are working. It's an indication that your immune system is managing to mount an immune response against the vaccine that you've been administered, and that you're likely to get some protection. So the minor side effects you get, which tend to last less than 2 days, 2 days or less, is fever, chills, pain at the site of the injection, joint and muscle pain, headache, and fatigue. And these are occurring around 10% of people who get the vaccine and resolve within a few days. Now, it's also reassuring to know that the people who are most likely to be affected by COVID-19, who are most likely to benefit from the vaccine, despite being more frail, the elderly, are also more likely to have mild effects from the vaccine, which is reassuring because they are most likely to benefit. They're more frail, but actually also less likely to have these side effects which I've mentioned here. So we know that the main side effects are mild side effects, resolve within 48 hours, and the vaccine is safe. Now, what about the more severe side effects? You remember that in December, when the Pfizer-BioNTech vaccine was approved and started being used in the US and in the UK, there were initial reports of a severe allergic reaction, which is referred to as an anaphylactic reaction, in a few patients. That led to a recommendation that people who've had severe allergic reactions to vaccines or any ingredients of this vaccine should not receive the vaccine, and that recommendation still stands. And that is why if you're having the Pfizer-BioNTech vaccine, you would usually have the vaccine, and then expectations that you'll be monitored for at least 15 minutes before you leave the vaccination site. So far, there have been at least 11 million vaccines, the Pfizer-BioNTech vaccine, administered in the UK, and information from the Medicine and Healthcare Products Regulatory Agency, MHRA in the UK, there have been around 223 reports of people having severe side effects, no mortality, no deaths, and this is 223 out of more than 12 million doses. So it is still rare, and there've been no mortality. So what about the evidence for risk of clots? Now, you've also would have heard, because this was in the news, that there were reports of potential increase in clot formation, clots in the legs or clots in the lungs, as a result of the Oxford AstraZeneca vaccine. And this was reported from a number of countries in Europe, and which led to the use of the vaccine being suspended until investigations were carried out by the different regulatory authorities. And that's exactly the process we want to monitor vaccine safety. And it's with pleasure that I'm sure you all heard that the UK Medicine and Healthcare Regulatory Authority, the European Medicine Agency, and the independent body of experts, the Commission on Human Medicine, all came to the same conclusion that there was no evidence of an increased risk of clots with the Oxford AstraZeneca vaccine, and therefore the countries that had initially suspended the use of it have restarted using it. So that's really clear. In the UK, it was reported in less than 1 in a million people who had the vaccine, so still quite rare. And clots in the legs and the lungs can happen naturally, and often there are many other risk factors, and COVID-19 itself is a risk factor for developing clots. And we know that COVID-19 infection makes it most likely to have clots, and the vaccine is actually likely to reduce the risk of you getting clots in your legs or your lungs. So in conclusion, absolutely no evidence that the Oxford AstraZeneca vaccine increases the risk of blood clots in your legs or lungs. Now, what about the group of the potential also side effect reported, which was blood clots in the cerebral veins? And there are some big veins in your brain that drain blood from your brain, and they are called sinus veins. And they are in some of your bones in your skull. And there's also suggestion that the Oxford AstraZeneca vaccine may also increase the risk of clots in the cerebral veins. This is also being investigated by the various regulatory authorities. In the UK, there have been 5 reported so far in the UK, with out of 12 million doses of the vaccine. And the conclusion from the analysis from the UK is that the vaccine does not increase the risk of clots based on information that we have so far of cerebral vein clots. And the risk of having a clot is 1,000 times lower than actually having dying from COVID-19. So the recommendation is still continue to have your vaccine. However, data is still being collected, and the Medicine and Healthcare Regulatory Authority is still investigating. And the recommendation is that if you have headaches that last more than 4 days after you've had the vaccine, or bruising in sites other than where you had the vaccine, then you should seek help from a healthcare professional. So the benefits of taking the vaccine, Oxford AstraZeneca vaccine, still by far outweigh the risk, and the recommendation is you should still have the vaccine. So how does the different regulatory authorities, and specifically in the UK, the Medicine and Healthcare Products Regulatory Authority monitors side effects. It does that through the yellow card system, and different countries have their own system, and the UK one is the yellow card system. And anybody can report suspected side effects from the vaccine through the this is with the website. The reports of side effects are suspected side effects, they're not proven side effects. So any member of the public, healthcare worker, can report a side effect if they think it may be associated with the vaccine. And reported does not mean it is proven as being caused by the vaccine. You would also appreciate that when you're rolling out a vaccine, for example, in the UAE, where over 60% of the population is now vaccinated, you have a lot of coincidental events that happen that potentially people may attribute to the vaccine. So a typical one that we smile about in infectious diseases is we've had a few people who've come to hospital with tuberculosis at the same few days after having had the vaccine, and people thinking the tuberculosis was provoked by the vaccine. Clearly not, because there's a lot of things that happen that are reported just by coincidence. So in summary, COVID-19 vaccines are the most effective tool present at the moment to prevent severe disease and death from COVID-19. We've had over 450, close to 500 million doses of the vaccine administered so far, and we have data now with over 3 months of use of the vaccines that the vaccines are safe and that they save lives. There has been no evidence that COVID-19 vaccines cause blood clots, and in fact, they probably reduce the risk of blood clots because COVID-19 itself increases the risk of having clots. And so the conclusion and the recommendation is that the benefit of the vaccine outweighs the risk, and you should take the vaccine when you're offered and protect yourself, protect your family, save your life, and also protect other people. And that's why a lot of us who are speaking today, including myself, have already had the vaccine and encourage you to take your own vaccine when you're offered. Thank you, and I'll stop there.
Thank you very much, Emmanuel, for that clear and concise talk. So there are a few questions coming in, and just to tell our attendees, we will be looking at the questions, and hopefully we will be able to answer all of them during the webinar. Sometimes, if I think a question is more appropriate for one of the other speakers, I will hold it in reserve. And any questions which don't necessarily fall within, or which we don't answer during the talks, we will try and answer at the general Q&A at the end. So, Emmanuel, there's a couple of questions which have come through. Some of them are not directly related to your talk, but as our in-house specialist in infectious diseases, I think you would probably be best placed to answer them. So one of the questions is, why is there a time limit to the protection provided by the vaccine? So, there's this debate is, are you protected for 3 months, 4 months? Why isn't it like, the hepatitis vaccination, which protects you for 10 years?
So that's a really good question. And the reason is because it's still very early days, because vaccines have just started approved and started rollout at the beginning of the year, end of last year and beginning of this year. So we know that people who have the infection, COVID-19 infection, they develop some form of immunity which lasts for probably 6 months or more. With the vaccines, we do not yet know how long they last because we are still getting more data. We think it's likely to be at least 6 months, probably a year, and it's time that will tell us how long the immunity from the vaccines lasts. And that's really a point of research which is going on at the moment to indicate how long the immunity from the vaccines lasts, just as well as how long the protection you have after having COVID-19 infection. But the reason why we think you may need extra doses is because we know that for most vaccines, the protection you get wanes with time, but we don't know exactly how fast it wanes because it's still early days. But if you were to ask us to predict what's likely to happen, I would think it's most likely to be more than 6 months, probably a year or more, but time will tell. And as we do more research, we're going to know how long the vaccines last, the immunity from the vaccines last.
And another question which came through is, we've only known about COVID for what, a year now, and yet there's all these vaccines for it. Why is it that diseases like HIV, which have been around for decades, we still have no vaccine?
So really important question, and I'm sure that question being asked from a number of different perspectives. The first, you would say HIV is also an important public health condition, just like other infections like malaria. I guess the question is also can extend to malaria. So why hasn't there been a vaccine before? And there has been research, there's been a lot of research to look for vaccines for other infections, which are just as important as COVID-19. Now, one of the reasons is with COVID-19, because of the scale of the pandemic, number of people affected, number of countries, number of continents affected, is that there's been much more concerted effort from the drug pharmaceutical companies as well as researchers to work together to find a vaccine. Secondly, there's also been a lot of funding that has been put into research to find a solution for the COVID-19 vaccine. And it is a lesson of how when you do put various experts together and also facilitate research with funding, magic can happen and people can, the researchers can actually find a solution. But underneath that is also, there are also virological reasons, in the sense that it is more difficult to find a vaccine for HIV because it's a completely different type of virus. First, it mutates and changes. Secondly, the way it causes infection and causes disease is more variable. With COVID-19, you have a really important way the COVID-19 vaccine gets into the cell, which is through a protein called a spike protein, the S protein. So that's a common and easy way to block the virus from getting to the cell. In HIV, it's much more difficult because there are different ways the HIV virus gets into the cell. So it's not as easy to produce a solution or a vaccine that will stop the virus from getting into the cell and causing infection.
Okay.
But I can imagine that there'll be a lot more with the success with the technologies developed with the COVID-19 vaccine, especially the mRNA vaccine, that those same technologies will be tried for conditions like HIV, and hopefully we'll get a vaccine.
Okay. Sorry, Emmanuel, can I just ask you, before I ask your final question, can I ask you to stop sharing your screen, please?
Thank you, will do.
And the final question to you is, after having had a COVID infection, is it possible to be reinfected?
So yes, unfortunately, it is possible, but it is extremely rare. There have been reports of people having a second infection 3 to 6 months after having the first infection. It tends to be in elderly people or people whose immune system is weakened for some reason, but it is extremely rare that it happens. So the majority of people, large majority of people, over 95% of people are unlikely to, this is unlikely to happen, certainly within the first 6 months.
Okay, thank you very much for that, Emmanuel. So before we move on to the next talk, I'd just like to thank the attendees who completed our poll and just talk a little bit about the results. So we asked, have you had your vaccine? 42% said yes, 58% said no. So the majority of the attendees haven't had their vaccine yet. And if not, do you intend to take it when offered? And I'm very pleased to see that, you know, the vast majority of you said yes. So 92% of you said yes, 8% said no. So it looks like today we're preaching to the converted, but the 8%, what we hope you take from our talk today or our webinar today is actually just to inform yourself, so that, you know, it's not our job to say you must or must not take the vaccine, but what we would like is for whatever decision you make to be made with the appropriate information. So making an informed decision, not a decision based on disinformation. Thank you. So our next speaker is Dr. Linda Bello, who is actually our current chair of CamDocUK. She's a GP, a general practitioner, and for those who don't sort of live in the UK, that's a family physician, and she works in London and Colchester. She has been actively involved in vaccinating patients at her surgery and is going to tell us a little bit more about her experience today. Linda.
Hello, thank you. It's a pleasure to be here as always. I'm just gonna share my screen. Dr. Mbene, may I please be able to share my screen? Thank you. Right. So, as Dr. Yuk has just said, my name's Dr. Linda Bello, and I'm a GP. I'm also the chairperson of CamDocUK. So it's my pleasure to be talking today about, what we've, the journey that we've been on with regards to COVID-19, specifically with regards to the vaccination. So, we all know about the vaccination program. It started on the 8th of December last year. I think we all remember where we were when we saw that lovely old lady having her vaccine in the hospital on the 8th of December. So that was with the Pfizer vaccine. And then after approval, we got our Oxford vaccine, or the AstraZeneca vaccine, I shall be referring it to as AZ vaccine, which was introduced a month later in January. And so far, I'm sure it's gone up today. When I did this slide, we had vaccinated 26.8 million people with the first doses, while 2.1 million people have had their second dose so far. I think those figures are a bit more today. This means that over half of all adults in the UK have received their first dose, which is really quite some achievement. And the target is to offer the vaccine to all over 50s by the 15th of April, and to all of the population, all the adults, by the end of July. So where do you get vaccinated? There's lots of vaccination sites, and actually we're so fortunate to be in a country where over 99% of us are within 10 miles of a vaccine service. So there's over 1,700 sites, and you may be asked to come in to have it at a larger vaccination site, which might be in a stadium somewhere, in a gym, in a big church, in a pharmacy, or in a hospital, or even at your GP surgery. And where I work at my surgery, we're a vaccination center, so I've been involved in vaccinating patients. So how can you get the COVID-19 vaccine? So usually you'll be in the priority list to get it now if you're aged 50 or over, if you're at a high risk from having coronavirus, so clinically extremely vulnerable. So you are clinically extremely vulnerable if, when we first went into lockdown, you were one of those that were told to shield and basically stay at home and don't go out. So definitely you should have already had your vaccine by now. And if you haven't had your vaccine by now, all these people on this list, you can actually book your vaccination online right now. You don't need to wait for us to contact you. If you're a frontline healthcare or social care worker, most of us have had our vaccines by now. If you have any other condition that puts you at higher risk, that will make you clinically vulnerable. So this is different from extremely clinically vulnerable. And people in this category are people that have sort of asthma, which require them to go to hospital, diabetes. But something that is not very well known is that actually having a high BMI, so a weight over your height ratio of 40 does put you as make you vulnerable. So you should be on the priority list. If you have a learning disability, you should be getting your vaccine now. And if you're the main carer for someone who is at high risk for coronavirus. So just a few days ago, I vaccinated a lovely 19-year-old who is the carer for his mum, who is clinically vulnerable. So making sure that, you know, if you do fit any of these, because this is where we are now, we're kind of at group 6 level now, and you know, we're trying to get all of these all the people on this list done as soon as possible. So what happens at my surgery when we're on the day we're vaccinating is that we would have already received a list of patients who are due their vaccine, and on the day of the vaccination, we've already invited them to come in. So everyone is booked into slots. So we invite them to come to the surgery. Most of them are the patients registered with us, but we do vaccinate people from other surgeries nearby. And on the day, I go to the fridge, I pick up a vial. Each of us will pick up a vial of the vaccine. I would draw it up. And normally I get 9 or 11 doses of the vaccine, which I can use to vaccinate the same number of patients. And I have my list. It's the same list all of my other colleagues have. I don't know who I'm going to be vaccinating on the day. I just work through my list. So I go out and I call the patients in. So there's no groupings by age or ethnicity. So there's not one vial for the Black patients, there's not one vial for the Asian patients. No, we just vaccinate with what we have, because I think this has been an issue where people have been thinking, oh, when we come in, we've got a specific one for the Black ones and the Asians. No, it's not like that at all. In fact, the majority of patients, obviously in the surgery that I work with, there's many Caucasian patients, and we've been vaccinating them since January. So what happens when I've called my patient in? I will check that, I'll check their name, obviously, make sure they're the right person. I check that they're suitable to have the vaccine, because not everyone is suitable for the vaccine. For instance, if you had a very severe allergic reaction to the vaccine, say for instance, if you were in the trial, one of the coronavirus vaccine trials. So I check you're suitable for it and make sure that you're not currently having coronavirus, you don't have a fever or anything like that. Because if you did have a fever, I would say, no, you can't have it today. I would discuss the possible vaccine side effects. So at my surgery, I am usually given the AstraZeneca vaccine, and I would go through all the side effects, most of the common side effects. And once I'd gone through them, I would then hand over to my patients a leaflet with all those side effects and other things about the vaccine. I then ask for their consent. You know, I have to document that I've had their consent. So it's really important that when you go and you have the vaccine, you don't think, oh, if I get there, I can't say no. Hopefully you won't. And I haven't had any patients say no so far. That we ask for your consent. This is all voluntary, but we hope that, you know, by everyone agreeing, most of us agreeing to have it, that we will protect ourselves and protect all of us. So what is the feedback that I've had from my patients? So majority of my patients are happy to have it. As I said, you know, no issues at all. 1 or 2, of course, you know, because, you know, it would be in an ideal world, everyone will come in and they'll be happy, but 1 or 2 have questions. I sit and I explain it to them, and normally when I've explained it, they're more than happy to have it. So far, I'm touching everything. We've had no severe reactions at my surgery, and we've vaccinated thousands of patients so far. We have a very good attendance rate, you know, a maximum of 2 people not attending per day. And when they don't attend and we have some spare vaccine, none of it is wasted. There's lots of patients that want to come in at short notice. At the moment, I've actually been vaccinating giving people their second doses. And when they come in and I'm giving it to them, I ask them, you know, when I gave you the first one, or when my colleague gave me the first one, what side effects did you have? And they said, oh, doctor, my arm hurt a bit for a few days. I felt a bit tired. I had a bit of a headache. I had some nausea. And that within a few days, they were fine, 2-3 days maximum. The over 70s seem to have very minimal side effects. Basically, one of my patients said, I came in, doctor, you gave me the vaccine. I couldn't feel it. I went home. I didn't have any side effects whatsoever. So she was really, really happy to have her second one as well. Most importantly, with all the news about blood clots from AstraZeneca vaccine, I mean, as Dr. Nsutebu said before, there's no evidence linking them, and we've not had any cases of blood clots so far, and most importantly, no serious complications at all. So what are my take-home points? Please, please, please book your appointment when you're offered. If you're in one of those lists of patients that I've said so far that you're over 50 and you still not received your vaccine, you should have, and you can book it yourself. So book it online. Check with your GP that you are coded appropriately for all your medical conditions, because the way you get called in for the vaccine or put in priority is based on the information that we have about you. Information like your weight and your height, which would tell us whether you're obese or not. Information about your mental health as well. Information about what you do for a living. Information about whether you're a carer. So this is very important. So if in doubt, please speak to us or at CamDocUK here. We've got a question and answer button on our website, CamDocUK.org. Your GP, your friends, and please, if you have any doubts, there's information out there. And with that, I shall end. Thank you for listening.
Thank you very much, Linda, for that real life experience of what's happening on the shop floor. There's a few questions which have come through, Linda. Some of them will probably just require short, sharp answers. So one question, someone's asking, are people offered a choice of vaccine, of which vaccine to take?
No, you're not offered the choice of what vaccine to take. At my surgery, we only have the AstraZeneca vaccine. So at smaller surgeries, that's what we would have. If, for instance, you went to a larger center that had the Pfizer vaccine and we found that you had a history of allergies, then it would be recommended that you had the AstraZeneca vaccine. In that case, we would ask you to come and have that. But you can't come to me and say, oh, Dr. Bello, I don't want AstraZeneca vaccine, because I wouldn't be able to refer you to have the Pfizer vaccine. And what I normally say is that, we know that these vaccines are equally effective, so there's no reason for you to try and choose one over the other.
Another question, will children under 12 be expected to be vaccinated?
No, so far there's no plans for that. None of the vaccines are licensed for children.
Fantastic. The available vaccines which are being used at the moment, are they protective against these new variants of COVID?
That's a very tricky question to answer, but what we're being told is that most of them are, and in the case where they're not, we're all expecting to receive some kind of a booster around September or October. Okay.
And someone's asking, have you got any experience or any perspective on the Sputnik vaccine, the Russian one?
No experience at all, but perhaps Dr. Nsutebu might know, but that's not a vaccine that is available, that has been approved for use in the UK. And as my remit as a general practitioner, not something that I've been looking at, but I think Dr. Nsutebu might have something to say about that.
Okay, maybe we can come to that again at the general Q&A session at the end. But thank you very much, Linda.
My pleasure.
So our next speaker is Mr. Charles Mambo. Now, I've known Charles since my medical school days, so over 30 years now, and he's a prominent member of the Cameroonian community here in the UK. Charles is the manager/director of a health and social care company based in London. He's previously worked as a local government officer and as a FIFA licensed football and match agent. The only downside to this man is his support for that other North London club called Spurs. Charles is going to talk to us about his experience as a non-medical person who has had the vaccine. So Charles, please.
Thank you very much, Dr. Ayuk, and thanks for the kind words. It is a great pleasure to be invited by this group of finest Cameroonian doctors to share my experience as a member of the Cameroon community here in the UK who's had the opportunity to take the COVID vaccine. And I think the topic for today speaks for itself, talking to the community about COVID-19. My experience on this topic will cover 3 areas that I have been closely involved in. Firstly, I will share my experience of taking the vaccine and the side effects, which was a brief for my presentation. Secondly, on the devastating effect of the pandemic as a provider of services to the elderly in North London, providing over 25,000 hours of care a month, and the effect of the COVID-19 to our service users, their family, and within my office environment. And finally, the effect of COVID-19 with close friends and within my home, conspiracy theories, worry, anxiety, and difficult decisions which I had to take. Permit me to just put in this little disclaimer before I start. The information I will share with you on my experience with COVID-19 and my vaccination is information I'm allowed to share, and it's personal to me, my friends and family. These are my personal views and not those of CamDocUK. It is not my wish to cause any hurt or upset or challenge anyone's views on this subject or on this call. I received my first dose of the vaccine on the 26th of January 2021, and I'm booked to take my second shot on the 13th of April. I was given the Oxford AstraZeneca vaccine. I was fine until the following morning when the side effects kicked in. I took the vaccine the same day with my wife, but I suffered from flu-like symptoms, chill, muscle ache, and was fatigued, whereas my wife had absolutely no side effects. A few paracetamols as advised did the trick, and within 2 days, I was fine. These symptoms were very mild and short-term. As a provider of services to the elderly and their families, I have seen the effect of the COVID-19 pandemic and its major effect on service users and their families. For those who unfortunately contracted the virus within our setting, I have seen the feelings of fear, anger, sadness, worry, frustration, and loss. Service users going to hospital because of COVID virus became a matter of serious worry, stress, and families not knowing whether their loved ones will come back home. And during the first period of the pandemic, we had a big board in our office where we had a list of those who went to hospital. And almost every week, we had a call either from the service user's family or from the hospital saying, Mr. A or B passed away. What do? We get a piece of paper, we wipe the name off, and we take it off our system. It was a statistic. And I think this was also happening within our community. They became statistics. And it was so painful, very worrying to see. Within my office, I have 16 staff. Luckily, 5 of them are Cameroonians, 3 are Nigerians, 1 Caribbean, and 7 Europeans. Of those who've taken the vaccine, because we're frontline workers and we were offered the vaccine, 2 Cameroonians are against taking the vaccine, 2 Nigerians are against taking the vaccine, and 1 Caribbean is against it for reasons whether she's worried whether she will get pregnant because she's a young lady. All 7 Europeans, this is British, France, Portuguese, have taken the vaccine. And so we asked the question, what is the reason for refusing to take the vaccine? And all of them came back they were on religious grounds. They had been told by their pastors or prophets not to take the vaccine, for it was manufactured to kill Black people. It is a chip which is meant to track you. It is the mark of Satan or devil. If you take it, and all these conspiracy theories, we see them on social media. But it's good to be amongst specialist doctors like you who can actually, during this call, re-educate our people, share proper information to help them make informed choices. It is difficult to understand why, with so much information, which some of us we're sharing today, that we cannot make informed choices for ourselves, but rely on others to make them for us. And then my final point, permit me to share my personal pain, worries, anxiety, and difficulty decisions within my friends and my family. My driver died from COVID-19 7 months ago. It is still raw and very painful. He was one of those in denial. The sad thing is I spent the last week before he became ill with him, either in the van he drove for the company or in my car. He stayed at home for 2 weeks before going to hospital. I wonder what those listening can guess what I went through, knowing that my driver that I spent the last week with him in the van or in the car had been tested positive and had been asked to self-isolate. What do you think I was going through? And I think every day we know that within our community, we're meeting people who haven't taken the vaccine, we're socializing with them, and until somebody said they've had COVID. So COVID is out there, it's real, and if we continue to deny to take this vaccine, we could be one of those statistics that I just mentioned. I also happen to have elderly parents who live with me and family. They have all refused to take the vaccine for religious reasons and because of the conspiracies that they read online and social media. They all have underlying health problems, including high blood pressure, diabetes. We have provided all the information about vaccines, but they have declined. Last month, we had a serious problem to deal with. One of them became seriously ill. We called an ambulance. And the ambulance came home and we told they had to be taken to hospital. And we knew they hadn't taken their vaccine. We know how the hospital environment is at the beginning of the pandemic and sometimes now where we've seen even within our practice that most people who go to the hospital without the vaccine, even though they're going for other underlying conditions, have come back or have contracted the disease. And some of them, unfortunately, have passed away. So with my family, we had to make a decision whether to allow this elderly family member to go to hospital or to leave them at home on the grounds that they hadn't taken the vaccine. It was a difficult decision to make. We eventually allowed them to go to hospital, but in the back of our mind, we're so worried, we're so concerned, and we know that if they had taken the vaccine, we might not have been in that situation. Before I end, let me just make the following few points. COVID-19 can have serious life-threatening complications, and there is no way to know how COVID-19 will affect any of us if we catch it. And if you get sick, you could spread the disease to friends, family, and others around you. Wearing masks, washing hands regularly, and social distancing can help reduce one's chances of being exposed to virus or spreading it to others. But these measures are not enough. Vaccines will work with your immune system, so it will be ready to fight the virus if you are exposed to it. I encourage you to book and take the vaccine if given the opportunity. Based on early data from clinical trials shared with providers like ourselves, experts believe that getting a COVID vaccine may also help you from getting seriously ill if you become unwell. Thank you very much.
Thank you very much for that, Charles. That's really heartfelt and really clear. And I hope it does, ring a chord with many of our attendees. At this stage, there are no specific questions for you. A few questions have come through, but don't worry, people, we will discuss them at the end of the webinar. We'll have a general Q&A. So, Charles, if I can just ask, if you have just one message for our audience today, what will it be?
I will tell, I think a lot of people speak of the COVID and the vaccine, and they don't interact or work in the field like some of us who actually visit homes of the elderly and people who suffer from COVID and see the pain. And what we've realized over the past few months is people going to hospital now are being discharged, and death and COVID has reduced because they've taken the vaccine. The vaccine has reduced the level, and the severity of illness amongst people who are ill go to hospital. So I encourage our community. I have taken it. It is safe, and it will protect you from other serious illnesses.
Thank you very much, Charles. So our next talk is by Dr. Christian Akem Dimala, who's a CamDoc member who finds himself in the unusual situation of currently living and working across the pond in the US. He's an internal medicine resident physician at Tower Health in Pennsylvania, and also a public health expert with interests in both communicable and non-communicable disease epidemiology and cost-effective prevention interventions. He'll be talking to us today about the perspective from the US. So Christian.
Hello, everyone, and thank you very much for giving me the floor. It's always an honor. I would share my screen so that we can go through my slides, if that's okay. Just give me 1 minute to do that. All right, so we're good to go. Just let me, can you all see my screen?
Yes, we can.
Okay, perfect. Okay, so I would crack on with the presentation. So, well, thanks so much for being part of this webinar and for giving me the opportunity to talk about vaccine uptake and side effects so far in the United States. We're going to be talking based on the outline, talk about the COVID-19 updates, talk about some updates about the vaccine, and talk about the side effects of the vaccine so far, what to expect, and what you can do from your end. So in terms of COVID-19 vaccine updates in terms of the disease. So since this pandemic, late November or November 2019, the United States altogether has experienced close to 30 million cases. And if you put that in perspective, that's almost the population of Cameroon. So the whole Cameroon has been infected in actual terms, looking at the population of the United States. And out of all these people infected, close to 500,000 have actually died. So the numbers are quite significant. And as we can see from the map on the right-hand side of the screen, the darker shades are the states where you have most infections, and that's mainly the lower states. And so the trends so far is, in terms of the cases, the United States, just like many other countries, did experience 2 waves. The first wave when the disease started, and the second wave sometime around November, December, with Thanksgiving, Christmas, and all the celebration. And right now the cases are downtrending, which is positive. Likewise, the number of deaths as well follow a very similar pattern, went up, and right now things are going down. Need to be on the watch, because this is a disease that can very, very easily pick up. And in terms of the vaccine, what's been going on? So the US, one of the countries that's been really fast when it comes to deploying the vaccines. And since vaccination started in the US in December 2020, we've had close to about 125 million doses of the vaccine administered to people. And the US, just like many other countries, did follow a system where priority was given to key workers, healthcare providers, the elderly. And that is why we have up to 70% of people more than 65 already vaccinated, already getting their first dose. And people 18 and above, it's about 30% having had one dose. Likewise, the same pattern is expected with regards to full vaccination, because the second dose of the vaccine is given usually 3 to 4 weeks after the first one. So we have 41% for people who are more than 65 and 17% for people who are more than 18. So right now, as of March 20, if we keep it going in the United States at straight curve, we expect to vaccinate close to 90% of the population by July, by summer, which is a very positive sign. And that is why we need and we depend on people to take this vaccine. We need people to come forward, because if we don't encourage people to take this vaccine, we will get to one point where people we will have the vaccine, but people will be coming forward to get this vaccine. So we need to keep this trend going. How does this do compared to other countries in the world? I think the US is the only country in the world that's deployed 120 million doses of the vaccine so far. But this can be a little bit tricky, because if you take into consideration the population of the United States compared to the population of the other countries, you would get to see that even though there have been so many doses, vaccinated about 25% of the population. The lower border there, the x-axis, is like the population, the percentage of the population vaccinated. And countries like Israel, the United Kingdom are doing very well. They're vaccinated close to 50% and close to 40% of the populations respectively. So that's amazing. So there is still work to be done. And this comes through letting people know that they need to go and get their vaccines. So what are the vaccine side effects so far? So the CDC said we have pain and redness and swelling expected at the point of injection, as we heard from the first presentation. And you can have tiredness, you can have headaches, you can have muscle pains, you can have chills, you can have fever, you can have nausea. So all of this is expected. And what can you do if you are expecting the side effects, or if you experience the side effects? The CDC does recommend applying a clean, cool, wet washcloth over the area and use or exercise your arm. I would say, give a personal example. For example, when I had my first shot of the vaccine, Pfizer vaccine, I had pain at the injection site for 24 hours roughly. When I had my second shot, by coincidence, I did exercise that day after my second shot, and I was excellent. I didn't have any pain at all. I felt really stronger than usual. Probably not the vaccine. I think it's worth using that arm, keeping it up and about, and also drinking a lot of water, especially if you experience something like fever, and dressing very light. So those are the recommendations from the CDC in terms of mitigating the side effects. Now, this is a very complex table, but I don't want you to read all the numbers. I just want you to focus on a few things which I'm going to point out right now. So on the left side of the screen, you have the side effects of the vaccine, injection site, etc., etc. But what I want you to focus on is the fatigue, okay? The headache, okay? The muscle pains, myalgia, the fever and chills, and the joint pains. Now, these side effects, you may not experience them the first time you get your vaccine, and it's not been that much reported, you know, few people reported the side effects on the first dose. However, when they got the second dose of the vaccine, they experienced more of these side effects: fatigue, headache, muscle pains, fevers, chills, joint pain. And this is data from more than 1.6 million people. So these are expected side effects. And if you get your second dose of your vaccine and you get the side effects, please don't feel you're dying. Please don't feel it's expected. As we heard from the first presentation, it shows that you're building up that immunity that you would need down the line to fight the infection. So very, very important to remember that these are things that can get worse on your second dose of the vaccine, the Pfizer vaccine, as we can see here. Now, understanding how the reporting happens can help us really know what to expect when it comes to hearing about side effects, hearing about people having clots, etc., etc. So what happens is, if you get your vaccine and you have a side effect, you notify the health authorities, right? But the fact that you've had a side effect or some effect doesn't necessarily mean it's because of the vaccine. So what does that mean? It means the health authorities, the CDC, the FDA, they receive lots of reports, clots, people dying, etc., after receiving the vaccine, but it doesn't mean that the vaccine is the cause. And so when they get all this data, they analyze the data and they make recommendations if the vaccine is safe or not. Obviously, they wouldn't recommend vaccines that are not safe because they are accountable. And that is why I urge you all to go to reliable sources of information to get updates about vaccine side effects. As we can see here on ABC News, there is no link between COVID-19 vaccines and those who die after receiving them. And this is after analyzing more than close to 2,000 reports of possible deaths or side effects. Very unlikely, no link. Likewise, NBC News talked about no safety problems with Pfizer and Moderna vaccines. Now, Johnson and Moderna are the ones that are mainly used here. You also have Johnson & Johnson, which is like the third one. AstraZeneca is on the way to being approved in the United States. But again, Reuters, which is a very trusted, reliable media outlet, first month after shots, there are no issues with Pfizer and Moderna. So go to news, get the right information, and please get vaccinated. I would like to end this presentation by a very interesting, a very funny one. When I woke up this morning, I received a message from a group about a patient who went to get his vaccine, and after getting his vaccine, he was walking home and he was seeing blood, and he thought it was due to the vaccine. So he got the vaccination center and said, I am seeing blood, is it because of the vaccine? And what they told him was, thanks for calling us. It looks like you took the glasses of the nurse and you need to bring it back and go get back your glasses, essentially. So it's just to say, you would have all sorts of reports that the vaccine has done X, Y, Z, but please rely on trusted sources of information and get vaccinated. Thank you very much.
Thank you very much, Christian. You know, that puts things in perspective, you know, and it's reassuring that the evidence emerging from across the pond is very similar to the evidence we have here in the UK, and in Europe. So thank you very much. What I'm going to do now is, I know a few more questions have come through, but I'm going to go back to Dr. Nsutebu now. We had originally planned to have a guest speaker from Cameroon, but unfortunately, due to unforeseeable circumstances, she wasn't able to join us today. But again, with his hat on as a infectious diseases consultant and someone who's been involved in a lot of actions around infectious diseases on the continent of Africa, we thought we've got our in-house man, Dr. Nsutebu, who can quickly give us a brief update. And then after that, we'll have a general Q&A session. Again, please remember, all of your questions to the Q&A box, and we'll try and answer as many of them as possible. Thank you. Emma, take it away.
Thank you, John, for that introduction again. I'm going to start by saying I'm currently not working in Cameroon or not living or working in Cameroon. So the information I'm going to present here is from the official COVID-19 situational report, which was published on the 17th of March, which we managed to get hold of today and decided to put a few slides to update the people attending this webinar. So please bear that in mind. So I'm going to keep it really high level and just highlight what is going on. So the first, really by doing this, we're going to answer the 5 W's or the 5 Y's, men or women, who is affected currently in Cameroon, where, when, what in terms of how are they affected, and why, and what is going on in terms of COVID-19 numbers and mortality, deaths. So those are the questions that I'm going to answer with the next few slides. So the official reports of number of cases of COVID-19 in Cameroon is 48,000. As you would appreciate, this 48,000 is based on people who have been tested and found to be positive. And so the real numbers are likely to be much higher than this, as it is in most other countries. This is not just for Cameroon, most countries, Africa, and even other parts of the world. The number of reported cases is by far an underestimate because most people in this part of the world, in Cameroon, will not get a test. So reports of 48,000 cases, close to 50,000 cases so far. The number of deaths reported from COVID-19 Cameroon is 721. And that in itself is also likely to be an underestimate. So the estimated mortality is 1.5% of in cases in Cameroon resulted in deaths. Around 1.5% of patients who have COVID-19 reported are also classified as having severe disease, and severe disease meaning that they need oxygen. They are unwell enough to require oxygen to support their breathing. Currently, it's reported that there are also around 504 people who are admitted to hospitals across hospitals in Cameroon, and around 120 being on oxygen. That is the statistics, but we all know and hear of people who are desperate for oxygen and can't get it in hospitals in parts of Cameroon, as we have colleagues also who have had difficulties getting their relatives to be admitted to a place where they have access to oxygen. So a big problem. All areas in Cameroon are affected. 98% of health districts are currently affected. So it's not localized to one part of Cameroon. Every part of Cameroon is affected currently. And we know that around 8% of people who've been reported as having COVID-19 have recovered. And that is the official data. So really important. Now let's look at what's happened with time. So answering the question when and how are the numbers evolving. This is really an important graph showing the number of weekly diagnoses. As you see early on during the year in 2020, last year, we had the initial first surge in Cameroon, and you see earlier on the peak there, the graph going up, and then we had a reduction in numbers. And then it was roughly a few hundred to 500 cases of COVID-19 a week. And then you've seen here in February, it started to go up. And up to March, between the 4th and the 17th of March, there were 8,700 cases that were diagnosed with 133 deaths. And this is why we're saying there's a second surge in Cameroon, and most other countries in Africa are going through this second surge. By far, the most predominant strain of the virus that is circulating is the South African strain at the moment, which is the strain that is also responsible for being more infectious and also more lethal in terms of causing death, more transmittable, but also responsible for more severe illness and death, also in younger people. We'll come back to that. So I hope this is a clear message showing that Cameroon is going through a second surge and peak between the beginning first 2 weeks of March high numbers of cases of COVID-19, and that is reflected in, as we all have family members. I personally also know that I have a lot of family members that have been affected, have developed COVID, in line with the statistics. So the statistics reflect what's going on in real life, what we actually feel as people from Cameroon. So let's look at the different regions. This is answering the question which parts of the country is affected. And by far the provinces, out of the 10 provinces of Cameroon, by far the 10 littoral province and also center province, is look at the cumulative number of cases. Center province close to 17,000, where Yaoundé is, and then Douala, littoral province, close to 14,000. So cumulative number of cases. So by far, so far in the pandemic, the provinces most affected is Yaoundé, is center, followed by littoral province. And then after that, you have this west province and the northwest province in third and fourth position. And if you look at the number of new cases, what is happening now with the surge, which areas are most affected? It's littoral, where Douala is, number of new cases, 2,600. And then followed by that, it's actually the west and the northwest before the center province. So what you're saying that during the second surge, it appears that the peak in terms of number of new diagnoses is littoral province, and then also northwest and west province, followed by center province, where Yaoundé is. So really important information. And you look at the percentage mortality here, the deaths and percentage mortality, you'd see that is high also in the west province, northwest, and also in the north. And this, I think, is a function of access to healthcare, access to oxygen, I would suspect, and the healthcare system being overwhelmed with the number of cases. And that's what happened all over the world when there's a surge, with the health system being overwhelmed. And when you don't have access to oxygen to look after the sick patients, this is what exactly happens. Now, this is quite unfortunate in terms of the number of healthcare workers that have been affected by COVID-19. And the report so far is that cumulatively 1,600 healthcare workers that have been infected with COVID-19. Now, not all these are hospital acquired, because you have community transmission, but a lot of it will be within hospital, within healthcare setting. And if you look at the deaths, unfortunately, the reports of 31 deaths, healthcare workers. Again, I suspect this is an underestimate of the numbers, because we all know a lot of healthcare workers who've had COVID-19 ourselves, and unfortunately deaths as well. But these are the official reports. Now, what about the surge and what's happening to healthcare workers? You can see that in line with the rise in number of cases in the country and different provinces, the number of new diagnoses among healthcare workers also going up. And that may be a signal of lack of PPE within healthcare setting, as well as environmental cleaning, reducing transmission in hospital, and also about practices in hospital, not only PPE, but social distancing, always wearing a mask, etc. A really important thing, and hence why when the vaccines do come in, healthcare workers need to be a priority in terms of protection. This, on the right-hand side, shows you the number of people who have been affected, stratified by age. And as we know from other parts of the world, the people who are most likely to develop COVID-19 and die from it are the elderly, so people over the age of 50. As you see here, the mortality is mainly amongst the people who are over the age of 40 and 50. And men seem to be more affected in terms of mortality than women. And I can't give an explanation for that, but it's an interesting finding. It may be because of just increased transmission amongst that group. So the question, I guess, is Cameroon is clearly in a second surge. What is being done so far? With the proviso that I'm currently not working in Cameroon and not working with the Cameroon COVID task force, what is written in the report, which I've summarized here, is they're doing screening at the points of entry and testing people as they come through airports and other ports of entry. And the level of testing seems to be the same, but the number of new diagnoses they are picking up from people coming to the country seems to be rising. And that's what is also in the report. They're doing more surveillance, testing more people in order to find out what is happening in terms of spread of the infection in all the provinces. And they're also doing testing in some prisons, because that's a closed group of people in an environment where if one person or a few people develop COVID, it's likely to spread quite quickly. And so they're doing also surveillance and testing in prisons to make sure they can detect people with, identify people with COVID-19 and reduce spread. Laboratory testing is also available through all provinces, and the South Province appears to be the only province where there isn't PCR testing, which is the gold standard for testing. However, all areas have access to a quick way of diagnosing COVID-19, which is an antigen test. And the antigen test can be done at the point of care. The point of care test is really simple, and it can be done at a really health center. And it's really simple to do. They are very sensitive when the person's got symptoms suggestive of COVID-19. So if it's likely to be positive if you already got symptoms. It's not used for screening if you haven't got symptoms, but it's good for testing somebody with symptoms. So antigen tests are available throughout the provinces, mainly I suspect through the big hospitals, provincial hospitals, but PCR testing also available in the provinces apart from South Province. There are also treatment centers in all the various provinces, but the majority of patients are being looked after at home. It's just the people who have severe disease, people who require oxygen, who are being admitted to treatment centers. But the majority, over 90% of people who develop COVID-19 will be treated in the community. They're also doing contact tracing and testing for contacts. I can't comment on the effectiveness of all this. I'm just describing what is in the report and what they're trying to do. And they've also got efforts looking at doing education through media, national media, radio, TV, about public health measures to prevent spread of COVID-19. And they also have a national helpline where people who suspect they may have the symptoms or don't know what to do can call and get advice. Again, I'm not commenting on the effectiveness. This is in the report. Preparations are ongoing for vaccination rollout, and Cameroon is one of the countries identified in Africa who will eventually get the vaccine. Some of countries have already started rollouts, such as Ghana. However, it hasn't yet happened in Cameroon, but they are, I understand, planning with the different stakeholders in Africa, CDC Africa, WHO, and Gavi, etc., planning to get the vaccines. It's likely to be a combination of different vaccines, the combination of potentially the AstraZeneca vaccine, the Pfizer vaccine, and also the Johnson and Johnson vaccine. But that is still under the planning phase. There are no vaccines yet in Cameroon. There will have to be discussions about how it rolled out in Cameroon, who to prioritize, such as healthcare workers and maybe the elderly, for reasons I've already shown you, and also people with chronic conditions. And then there's also efforts to provide psychological support. I've shown you the number of healthcare workers in Cameroon that have been affected. Cameroon already has a problem with a shortage of healthcare workers. You can imagine that with the number that are currently affected, doctors, nurses, pharmacists, etc., and also deaths, and this is going to worsen that. And there's also a lot of psychological trauma for staff looking after patients and seeing them pass away, as well as their colleagues who passed away. And so they're also providing counseling and support groups for healthcare workers. So I'll stop there, and I hope it gives you a feel of what's going on in Cameroon at the moment and what the Cameroonian government and Cameroonian COVID control task force is trying to do. Thank you.
Thank you very much, Dr. Nsutebu. That was really, again, a nice, concise summary of what's going on. Now, before I go to the questions, could I just remind our audience that the survey has now been put up in the chat. So we'd be really grateful if you could fill in the survey for us, because obviously it will help us improve the webinars going forward. Okay. So there's a few more questions here, and relating particularly to the last talk. One person says, so there's a comment saying apparently the Johnson & Johnson and the Sputnik V have been announced today as the preferred vaccines for Cameroon. Someone's asked a question about, if you remember, early on in the pandemic, there was a statement going around saying the virus cannot survive in the heat and therefore hot countries will be less affected. Can you comment on that, Emmanuel?
That's a really useful question, and that was a suggestion at the beginning of the pandemic, which has not been proven to be the case. All countries that are blessed with high temperatures and good weather have been affected, significantly affected by COVID, and that includes the Middle East, where I am in the UAE in the middle of summer, where it was scorching here. We still had a lot of patients with COVID-19. So there is no really evidence, no epidemiological evidence that there's an association between heat, hot weather, and a low number of cases. Now, I think if you were to say it's hot in Africa, and why has there been in the past reports of potentially less number of cases and less deaths? The number of reasons for that. It is not the weather. It is most likely the younger population. Africa has a younger population. I showed you in the statistics from Cameroon, and worldwide, we know that the elderly and people with other chronic conditions are more likely to be affected by COVID and more likely to die. When you have a younger population in the continent, you'll likely have people get infected but don't actually develop the complications. That's the most likely reason. Another potential reason might be because it's hotter in Cameroon, and in the country, not that the heat kills the virus, but people may sleep with their windows open, so there's more aeration, and COVID is airborne. So being in a house where we sleep with windows open may potentially reduce transmission. Not proven, and that is a theoretical reason for that. Okay. But heat does not reduce the risk of you getting COVID.
Thank you. Another question, and I'm not sure about this one. It says, why are young people in Cameroon being subjected to the COVID vaccine in school? Is that something you're aware of?
So I'm not aware of that, because we know the vaccine is not yet in Cameroon, and I haven't seen a plan for rollout of the vaccine. I would be surprised if they would start roll out the vaccine targeting children and schools, because the groups that are considered to be high risk in all parts of the world are healthcare workers, frontline workers, people with other chronic conditions, which means they're more likely to die from COVID-19, or the elderly. And we also don't have research for effectiveness and safety of the vaccine in children. It's likely to be effective and safe if you extrapolate, and we see no reason why not, but we don't have the data. And there are currently research studies starting in the US, in UAE as well. The Chinese vaccine, Sinopharm vaccine, there's a study that's going to start in children. So I would be surprised if that approach is taken in Cameroon. I haven't heard that's happening. I don't think it will happen.
Okay, thank you. So now, actually, what I'd like to do is invite all of our panelists back, and we can go through some of the more general questions, and whoever feels best equipped to answer the questions can answer them. So we start at the top. There's a question which I think you wanted to answer, Dr. Bello. Are people being offered different second vaccines from the first ones?
So yeah, in general, no. If you've been vaccinated with Pfizer, the first time you'll be vaccinated with Pfizer for your second dose. Same with AstraZeneca. Obviously, there may be cases where a patient has been abroad and they've been vaccinated with one vaccine there, and they've come here and they're due their second dose, and we'll give them what we have. We do know that we're able to mix and match if needed, and there's certainly some trials going on about that. But in general, the first dose you get will be the second dose. The vaccine you get in the first dose will be the second dose you get as well.
Okay, thank you. And next question, Dr. Nsutebu. Of the types of vaccines existing on the market, are some more efficient than others? Can you tell us about the Chinese and Russian vaccines, because those are the ones reaching Africa more easily for now? And also, second part to that question was, today we hear a lot of talk about variants which are more contagious and more lethal. How efficient are the existing vaccines on the variants?
That's a really big question, and probably can spend 10-15 minutes talking about that question.
You have 1 minute.
I'll keep it really short, in the sense that there are different types of vaccines, and the most common ones are the traditional vaccines. Traditional vaccine, I mean, where you take the whole virus, kill it, and then use it as a vaccine. And that is the basis of the Chinese Sinopharm vaccine, which has been approved for use in different parts of the world, China, and also in the UAE, where I am at the moment. It's being rolled out here. And it's a traditional type of vaccine where we have a lot of evidence of use of that type of vaccine. It is the Chinese vaccine. There hasn't been an official publication of the safety and effectiveness in scientific journals. We're waiting for that. I've been told it will happen in the next month. But the publication from the Ministry of Health in UAE, in Abu Dhabi, is the Chinese Sinopharm vaccine appears to be at least 80% effective in preventing infection and close to 100% effective in preventing severe and moderate disease, preventing hospitalization and deaths. So, and that is a theme really for all the vaccines in terms of effectiveness. Now, all the vaccines are very, very effective in preventing hospitalization and deaths, probably over 90%. In terms of preventing infection, some are less effective, such as the data we have from the suggests that probably around 80% effectiveness for vaccines such as the AstraZeneca vaccine. But for the Pfizer BioNTech vaccine and the Moderna vaccine, the Sputnik vaccine is also likely to be more than 90% preventing infection. The Russian vaccine, there's a lot of scientific publication around this Russian vaccine, phase 1-2 trials, and more recently even phase 3 trials. There's a really important publication in the Lancet recently showing the effectiveness of the Russian vaccine and safety of the Russian vaccine in terms of preventing infection and severe disease, more than 90%. There are also differences in storage of the vaccines, how you store them. The Pfizer and the BioNTech, you store them at really ultra low temperature. And so you have to have a super cold chain to use it, which is why it's probably not the best for Africa, because you need cold ice to store it. So hence why you may find that in Cameroon, they're going more for the Sputnik Russian vaccine, and also the Johnson & Johnson vaccine, which also needs just fridge temperature for storage. The last thing I want to say, I think answers your question, is about effectiveness of the vaccine for the various strains, because I mentioned in the talk that the strain circulating in parts of Africa, and Cameroon specifically, is the South African strain. And there've been some studies in South Africa that have shown that the Oxford AstraZeneca vaccine is not as effective for the South African strain. There's still more research going on to confirm those findings, but that may be why in Cameroon they may steer towards getting more of the Sputnik Russian vaccine and the Johnson & Johnson vaccine, just because of the data from South Africa suggesting that the Oxford AstraZeneca vaccine may not be as effective for the South African variant, which is circulating in Cameroon.
Okay, thank you. Yeah. Another question, and this one I'll direct at Dr. Bello. If a person is sound and healthy prior to taking the vaccine and eventually becomes unwell due to side effects of the vaccine, like blood clots, it calls for concern, doesn't it?
Well, it will call for concern if we're sure that what you caught, so for instance, the blood clots was definitely caused by the vaccine. And so a lot of the symptoms that some people are describing, especially the blood clots, are probably things that would have happened anyway. As I said earlier, and Dr. Nsutebu has said, there's no link between blood clots and the AstraZeneca vaccine or any vaccine. We vaccinated nearly 12 million people with the AstraZeneca vaccine, and there's been no increased risk of blood clots. In terms of any sort of side effects that you get, they are very, very few and far between. And when you get them, they don't last more than 2 to 3 days. We need to remember that, you know, if you do get COVID, that you can get really serious side effects because of COVID, really serious, you know, you can get long COVID where you become quite breathless, you can't do your normal activities, you can have heart failure, you can die from COVID, let's not forget that. So I think a vaccine where you're getting, you know, side effects that are not lasting only just a few days, you know, there's no question as to you not taking it. And of course, all these vaccines have gone through rigorous trials and have been approved by our Medicines, Health and Regulatory Authority, the MHRA. So no, I mean, if 1 or 2 people get a really serious side effect, you know, this can happen with anything. Paracetamol, which you take every single day, you know, you can have a very serious side effect from taking paracetamol. One in 10,000 people might have a serious side effect from paracetamol. It doesn't stop you from taking it for a headache. So I think we should look at everything in context and look at the bigger picture in terms of what these vaccines are doing for us.
Okay, thank you, Nina. Next question. Again, I'll direct this one at you. We have only just had the vaccine and they're already talking about boosters as well as the flu jab. Seems suspect. Do you have any comments to that? If there's someone who's a bit suspicious of the rollout of the, you know, and of the COVID vaccine and some of the, I suppose, projections which are being made.
Yes, yes. So we are making these projections based on the fact that, one, we probably think that and Dr. Nsutebu knows this better than I do, that perhaps what we're going to get, the sort of protection we get might last 6 or 7 months, we don't know. And also because of the fact that there's new variants, this was the same question I answered before, that if we have new variants, do we know whether this vaccine will cover it? And because the vaccines were made when these variants were not yet in existence, then the vaccines are going to be tweaked and then you can have it as a booster. So there's nothing suspect about it. It's just about sort of following the science, and that's what's happening. And when you get your flu jab every year, you know, it's based on what has been circulating in the system in the last sort of in the population in the last 6-7 months. It is not strange that we should expect to have that. None of that is set in stone yet, but that's what we project. That's what we think is going to happen.
Okay, thank you. And another question, which I think I'll give to you because it falls within the sort of remit of your talk. Someone says, my neighbors who are extremely vulnerable haven't had their jabs yet, but my husband and I, who are Black African, keep getting phone calls and text messages to come for the vaccine. Can you comment on that?
Yes, without knowing all the full facts, what I would say is that that's very, very unlikely, and there must be a reason why. So it may be that your neighbors are housebound, and those that are housebound have to have a special team of doctors that come and give the vaccine. So it will usually be your GP coming to do that, or a different sort of organization that have been commissioned to do that. So all of those that can book, because I just said in my talk, if you're over 50 and you haven't had a vaccine, you can go online and book your appointment. Now, if for some reason your neighbors can't get to those centers, of course, someone has to come and visit them at home to give them the vaccine. And that is, and that might be where there were some delays, but very, very unlikely. And I suggest, one, that she gets the neighbors to call the GP and find out. We'll be able to help her. 2, if the neighbors are mobile, get online and book them an appointment and take them to the center, and they'll have it done very quickly.
Okay, before I look at a couple of other questions, there's a comment which has come through, which is actually quite an interesting comment and very true and very relevant to what we're talking about today. And that comment has disappeared now, but basically what the person was saying was that actually we're focusing on efficacy of these vaccines at preventing the disease, but one of the things we really need to look at, and I think that was something which emerged quite clearly in the UK strategy of giving as many people one dose of the vaccine as possible rather than fewer people, both doses, is that, these vaccines prevent, severe illness and hospitalization as well. So you may still get COVID after your vaccination, as Dr. Nsutebu pointed out earlier on, but it stops or it prevents severe disease, prevents hospitalization, prevents death. So let's have a quick look at more of the questions before we come to an end. So how come the COVID test most reliable is the one requiring to pay, yet we are bombarded with millions infected from the NHS testing source? Linda, is that something you?
Sorry, I missed the question, John.
So basically the question is around, obviously, or the attendees suggesting that the most reliable of the COVID tests is the one you pay for. But the free ones are, people are being diagnosed as having COVID on the free ones, which I presume the implication is they're not as high quality. Is that something you can comment on?
That's really news to me, because the only reason you would go and do a private test is if you needed that test to go to travel. But we have lateral flow tests, we have PCR testing, and so I really wouldn't agree. I really wouldn't agree with that at all. And there's no reason for us. I guess the suggestion is that we're overdiagnosing people with COVID, or are we missing people that have COVID? But the bottom line is we're at a stage where most of the tests that have been done have been shown to be effective at diagnosing COVID, and that's what we're using to obviously roll out the vaccination program. So I'm not sure where that person was coming from, but our tests in the NHS are usually more rigorous than the ones that are offered privately. You may be asked to pay more, but it doesn't mean that the test that you get for free in the NHS, we're still paying for it, is of any lesser quality.
Okay, thank you, Linda. A question directed at Dr. Nsutebu. What explanation can you give about immunity in people who've had COVID? Do they really need 2 vaccines? How long does immunity last after a moderate severe infection? And what advice do you give to people with long COVID concerning the vaccine?
So a really important question, and multiple layers to that question.
Indeed.
In terms of the immunity, so people who have had COVID-19, the immunity they get from it, as I said previously, probably lasts at least 6 months, maybe more, but we haven't had enough time to know that, and more research will figure that out. So probably at least 6 months. People who have moderate to severe disease are more likely to have a strong antibody response. And so and we suspect the immunity will probably last longer than people who had asymptomatic or mild disease. So the more severe infection you had the more likely you are to have high levels of antibodies, and that's been shown also in studies. In terms of if you've already had the infection, do you still need the vaccine? The answer is yes. COVID is not the first condition where vaccines may actually provide more protection than the infection itself. That's been shown with other vaccines for other things, such as the human papillomavirus vaccine, where the vaccine is potentially more effective in causing an immunity and immunity lasting longer. And in the studies research studies for the different vaccines, the Pfizer and the BioNTech and the Moderna vaccine, people who had COVID-19 and also had the vaccine also appeared to be protected without a risk of side effects. So the recommendation is, even if you've had the infection, that you should still have the vaccine. For most people would say wait until you're fully recovered, and which means people would be wait for at least sort of 3 months, because the protection from the infections last that long. So there's no rush in giving you the vaccine. So wait until you're fully recovered and then have the the vaccine. In terms of long COVID, people with long COVID will have symptoms similar to what you refer to as chronic fatigue syndrome, with mental fog, fatigue, malaise, and what you call payback. So they exercise and they feel tired after exercising, and that can last months. And after COVID, there is a potential that if you have a vaccine and you have the side effects which I described in my talk, that may put you back and make you more tired, because fatigue is a potential side effect. However, you can imagine that there is also still a risk of having COVID again, and it will even be worse than side effect of the vaccine. So for people who have symptoms suggesting that they may have long COVID, I would say discuss with your healthcare professional. If your symptoms are improving and stable, and you're more than 3 months from having had the infection, the recommendation would be to still have the vaccine. Thank you.
Thank you, ma'am. Okay.
John,
I know we've gone over our time a little bit.
Sorry, John, there's one question in the chat that I've just seen. I think it's just important. It's from Wendy, and she wanted me to share the screening tool that is being used before the administration of the vaccine. Obviously, it's not in a piece of paper somewhere. It's just what we read out. But Wendy, there's 8 questions, and on there is: have you had coronavirus? Have you tested positive for coronavirus in the last 4 weeks? Do you have symptoms of coronavirus? Have you had an allergic reaction to the vaccine? Could you be pregnant? Are you on any blood thinning medication? And those are really the main things. There's nothing secretive about it. It's just us trying to make sure that you're well enough on the day to have it, that you're not bleeding, you've not had a different vaccine in the last 7 days, which could have interacted with it. Hope that answers your question, Wendy.
Okay.
If you don't mind, I just want to just answer another really important question, because that's come up in the chat about why we're talking so much about the vaccine and not the other public health measures. But the answer is, we are talking about both. And even when you've had the vaccine, it doesn't mean you stop wearing a mask and you stop social distancing and etc. So it's like going to a car and wearing your seatbelt. The vaccine is like you put your seatbelt on, you still drive slowly and carefully, because you're still at risk of having an accident, still at risk of developing COVID. The risk is lower. You've got your seatbelt on, you've had the vaccine, but you still need to take the precautions. So we're not saying vaccinate and stop all other measures. We're saying, in addition to the measures, vaccinate, and that significantly reduces the risk of infection and severe disease and death. Thank you.
Okay, thank you, Emmanuel. So I am going to draw this webinar to a close. I'd like, if there are any questions which haven't been answered, please, if you go to CamDocUK website, you can put the questions on there, and we will endeavor to answer them. I'd like to start by thanking, first of all, the attendees, because you are the ones who make the webinar. Otherwise, we'd be sitting here talking to ourselves. I'd like to thank the people who made this possible, who made this run. So Dr. Valentine Gua and Dr. Anam Bene. I'd obviously like to thank our brilliant speakers, Dr. Linda Bello, Mr. Charles Mambo, Dr. Emmanuel Nsutebu, who you got a double dose of, and Dr. Christian Akem. And all I can say is, if you go onto CamDoc website, we have just produced a video on COVID vaccine, and we're actually in the process of preparing another one, which will be in Pidgin English, which we can aim more at the masses in Cameroon. So thank you very much. Thank you for attending, and I hope you found it useful. And obviously keep your ears open, because we will be having more webinars, and we would love to have you join us. Thank you. Good night.